If you're like most people, the thought of getting colon cancer or even going for a colon cancer test can be frightening to you. What if they find something, you're probably thinking? Then what? Besides, colon cancer deals with a part of the body that is, shall we say, not easy to talk about. Well, the good news is colon cancer is a cancer that can be found and removed before it has a chance to become a danger to you. Colon cancer is cancer of the lining of the lower parts of the bowel, called the colon and the rectum. Colon cancer is one of the most common cancers. Both women and men can have it. And the chances of having it increase as you get older, starting sharply at age 50 and continuing as you age. Fortunately, you do have the power to keep colon cancer out of your life. Let me tell you how. Most colon cancers start with a growth called a polyp. If you find and remove the polyp early, you can prevent cancer from even occurring. How do you find it early? There are several ways. Here are two of them. There are tests that can detect tiny amounts of blood in the stool, and tests that use flexible instruments for a direct look at the inside of the colon. Let's see how these tests work. Very early changes in the lining of the colon often bleed. The amount of bleeding may be so small that it's not enough to see. But a special test called the fecal occult blood test can detect these small amounts of blood and act as a warning. There are different ways to check for blood in the stool. Let's talk about the most common test used today. Your doctor will give you a kit to test your stool. The test is very simple. Read the instructions on your kit about how to collect your stool. Collect a small amount. You don't need much. Smear it on the collection card. Repeat this test with your next 2 bowel movements. After collecting the 3 samples, return the card to the lab or to the doctor's office. If the test shows blood, your doctor will want to do other testing. If the test was normal, you will need to repeat it in a year. It is that simple. Tests done by the doctor during a rectal exam and tests that are dropped into the toilet bowl should not be used. The lining of the colon can also be examined with flexible instruments. Shorter tubes can reach only the lower part of the colon. Longer tubes can examine the entire colon. In both tests, the tube is inserted through your rectum. The 2 procedures are a little different. For a sigmoidoscopy, the colon will need to be cleaned out as much as possible. Usually, that means that you'll only have clear liquids for a day before the test. The night before, you'll take a laxative, and in the morning, you will give yourself an enema. A sigmoidoscopy can be done in the doctor's office using the shorter tube. You may feel pressure and a cramping as the tube is passed up your colon. The exam will take about 20 minutes. If the doctor sees anything unusual, she can take a sample and examine it for cancer. If she finds a polyp, she can remove it. Depending on what is found, your doctor may suggest a colonoscopy. Remember, removing a polyp will keep it from turning into cancer. Colonoscopy uses a longer tube to take a look at the entire colon. You'll need to be on a clear liquid diet for 1 or 2 days. The night before the procedure, you may take a strong laxative, which may be followed by a large amount of fluid. A colonoscopy is done by a specialist, a gastroenterologist, or a surgeon, in an operating room or a procedure room rather than in your doctor's office. You'll probably be given medications to help you relax and maybe even go to sleep. The procedure will take about an hour. If the doctor sees anything unusual, he can take a sample and examine it for cancer. If he finds a polyp, he can remove it. After the procedure, you'll need a friend or relative to drive you home. Fecal occult blood test, sigmoidoscopy, colonoscopy. Each has its own advantages and limitations. The fecal occult blood test is simple and inexpensive and needs to be done every year. Some people find sigmoidoscopy to be uncomfortable. The test checks only part of the colon, but it can be done in your doctor's office without sedation. If the test is normal, you'll need to have it every 5 years. But if a certain type of polyp is found, you'll need a colonoscopy. The preparation for a colonoscopy can be uncomfortable, but you'll be given medications to help you relax. A colonoscopy does offer the most thorough look at the entire colon. And if nothing is found, you won't need another test for 10 years. The choice of tests depends on what you are comfortable with and which tests are available. If you have a family history of colon cancer, or if you have certain medical conditions, a colonoscopy will probably be suggested. Talk to your doctor about which test is best for you. Remember, most colon cancers can be prevented or successfully treated if they're found early enough. So if you're 50 or older, make a decision. Get tested. The only wrong choice is not getting tested. If you'd like more information, the American Cancer Society can help you. Just call us anytime, day or night, at 1-800-ACS-2345. We can tell you more about your testing choices, help you talk to your doctor, or just listen to your concerns.